with us today, I'm really honored to have Dr. Mark Shalauta. He is family medicine, very, very well qualified on the topic of vaccines. He actually is co-chair of our Scripps Medical Foundation Vaccine Committee. He also serves on a county vaccine advisory group, and he was a member of the Scripps Advisory Council as well. So very well qualified, very well versed on the topic of vaccines. So welcome to this, and thank you for helping us keep our staff and patients safe. Very, very important right now with the surge of Delta that we are seeing. So with that, I'm just going to kick you off right off the bat and say, people are worried about the mRNA vaccine versus the standard technology of Johnson & Johnson. Can you just tell us a little bit about the vaccines in general?
So in general, people are worried because this is supposedly new technology, although the technology has actually been around for years. And it's the first time that it's being used in vaccines, but it has been tested and been around for a long time.
Okay. And then for people that are worried about mRNA vaccine, they have an alternative, right? The Johnson & Johnson technology.
So absolutely. So we have the three, current available in the U.S., currently approved, are the Johnson & Johnson, which is a little bit more traditional vaccine. And then you have the Moderna and Pfizer vaccines.
People are thinking that there's animal products or fetal cells in the vaccine. Can you tell us the truth about that?
There's no animal products in the vaccines at all. And then as far as the fetal products, the way that came about is some of the older vaccines. So this is not the Moderna, not Pfizer, but the J&J vaccine. It uses cell lines that are 40 to 50 years old in the manufacturing process. But again, that is completely washed out and not part of the vaccine at all. So there's no cell lines or fetal products at all in the vaccine.
Okay.
And again, interestingly, a lot of the religious leaders, including the Pope, have said, this is completely fine. It is okay to, take these vaccines. But even if you still are uncomfortable with that, there's still the mRNA vaccines, so Moderna and Pfizer, which are completely cell-free.
Fertility. Tell us about fertility.
There was some concern that the spike protein is very similar to some cells that are in placenta, so in the human placenta. So if you were building antibodies against the spike protein, then that would go against the placenta, and then you'd be infertile. You'd keep on miscarrying. So that turned out, first of all, not to be true, because they are no more similar than like me and you, our social security numbers being the same, because they have the number 5 in it. So they're really not the same, number one. And number two, if you were to get COVID itself, COVID disease, then you're going to be building antibodies, and then in theory, you'd be infertile. So first of all, it's not true. And so you don't even have to worry about it.
If I've already had COVID, I'm hearing that I don't need to get a vaccine. And can you tell us the truth about that?
So you do have some immunity just by getting wild type disease. So there is some truth to that, but it seems like by getting the vaccine, you're actually getting a little more of a boost, and first of all, stronger immunity and more long lasting. So it's still recommended to get the vaccine even if you had COVID.
Plus with the variants, right? So even if you got the COVID, whenever you had it, it doesn't mean that you have the antibodies against the new strain. So
right.
Is there some protection that the vaccine gives you against all those other variants?
That seems to be the case. If you had COVID, you're less protected against some of the newer strains, versus, again, with the vaccine, you get a very robust response, even with the newer strains that we're seeing.
How about this going to be messing with my DNA, and there's a microchip in there, and this is all just a plot?
It's amazing how things start and then get a life of their own. I mean, I just watched the video on TikTok that, someone's checking, they got their vaccine, they do this chip reader, and they see that's like, oh, there's a chip in there. It turned out to be a joke, and the person, later said this was a complete joke. It was not real, but it already has a life of its own. So it's circulating out there. So as far as it integrating into your DNA.
Yes.
So that's easy to see how, that can be confused, because it's RNA. So is that, that's genes, but it does not actually go into your into your DNA. So it goes into the cells, and all RNA is instructions to make a protein. As soon as that's read, it's degraded immediately. It doesn't go into the nucleus of your cell where your DNA is, and never gets integrated into your genome.
The other one I've heard of, as we're doing the myths, is one shot is enough. Like, so yes, J&J is a single shot, but for mRNA vaccines, why can't I just get one shot and be done with it?
So it doesn't seem like you get the type of immunity you really want. It's almost like it's almost like a little bit from the first one, but then you get this great surge of immunity, and both antibodies and T cell immunity. So you really want, again, to get that really robust response. If you were ever exposed to COVID, you really need those 2 shots